Hi everyone, my name is Billa. I'm here today on behalf of Taibu Community Health Center for a public awareness campaign on chronic disease and Black health. I'm filling in for Khadr Abdul, and today we are talking about cervical cancer. I'm here with the lovely Dr. Danielle, and please introduce yourself.
Sure. Thanks so much for having me, Billy. I'm Dr. Danielle Brown-Shreves, family physician, also the CEO and founder of Restore Medical Clinics. I do a lot of academic work as well. I'm an assistant professor at Queen's University and an adjunct professor at University of Ottawa. And I'm happy to be here with you today.
Thank you so much for supporting this campaign and letting us film in your clinic. And it's beautiful to see such a facility owned by a Black doctor. When we started, it was still in the process of starting up, the second and third floor. And now it's great to see clients on the second floor and doctors there. So congratulations, it's wonderful.
Thank you. Thank you.
So today we're talking about cervical cancer, and just to be very clear, cervical cancer is something that only is affected by women.
Yes.
And men do not have cervical cysts.
Yes.
Okay.
You're correct.
Just to be
correct.
For the viewers at home.
This is a woman's health topic. Yes. So women have cervix. And when we speak of cervical cancer, we're speaking specifically to women. Yeah.
Okay, wonderful. So what are the risk factors for developing cervical cancer?
So there are several. HPV, or the human papilloma virus, is one of the main risks for developing cervical cancer. Also, things like smoking puts women at higher risk for clearing the HPV virus, which means that smokers tend to have a higher risk of developing cervical cancer in the future. Multiple sexual partners also puts a woman at risk, and early exposure to sexual intercourse as well. Right. So basically all those things really just provides more opportunities to expose a woman to HPV, which ultimately is the culprit.
Okay. And how is cervical cancer diagnosed?
So, like in terms of diagnosis, there is like multiple layers to that, right? So usually a woman would come in to see a family physician like myself or another practitioner, and we'd want to take, a proper history, physical examination, and there are things on the history and the examination that could point to that diagnosis. But ultimately, we screen women for cervical cancer using a pap test, right? And when we say screening, we're screening people without symptoms. So they don't have symptoms yet. They come in, they do it routinely. Essentially, we're taking cells from the cervix, looking under a microscope, seeing whether they're abnormal or not. And that's usually the first point in terms of a diagnosis. If that comes back abnormal, then we'll want to take things a step further by doing what we call a colposcopy with a biopsy. Because once we have a biopsy, then we can diagnose cervical cancer.
And so for some of the other diseases, chronic diseases we've talked about, it was specific age group that affected them. For cervical cancer, is this something that women of all ages should be getting checkups on, or is it at a certain age you should start?
Right. So we start screening in Ontario at age 21.
Okay.
Right. And the recommendation is that women would be screened every 3 years, providing they're healthy women. And who have not had a history of previous abnormal PAPs. So if someone were to say have HIV, for example, we'd want to screen more often because, patients with certain illnesses, they may have weaker immune systems and more susceptible to cancer, right? But the average healthy female starts at age 21 when they're sexually active.
Okay.
Yeah.
But is it whenever you start becoming sexually active, that's when you should start doing checkups, or is it more so the age 21?
So sexually active and age 21.
Okay.
So if you're 21 and not sexually active, then you don't need to do a pap test.
Okay.
Yeah.
Okay. Perfect. Can cervical cancer be prevented, or is it one of these diseases that if you have a certain genetic disposition to it, that you're able to get it, or through diet and whatnot? Is it something that we can prevent? Or?
So definitely, I mean, in terms of prevention, we're looking at modifying risk, essentially, right? So we spoke about some of those risks, HPV being one of the biggest risks, right? So we can prevent HPV through immunization, and that is integrated in our school programs now. So that's a very good thing for parents to consider for their young ones. And that will protect against HPV. Now, also, like smoking cessation would help because we said that smoking is also a risk factor, right? And then, other things like, condom use can also help, like limit that exposure, because we said multiple sexual partners starting at an early age. So if whatever you can do to modify risk will essentially reduce or help to prevent cervical cancer.
So we talked about what cervical cancer is, the diagnosis, the prevention, but what are the potential complications of cervical cancer if not properly treated?
Right. So if not properly treated, like most other conditions, things tend to just get worse, right? So when you're looking at cancer, remember we said that it's really just, cells replicating abnormally. So you'll continue to have that process going on, and you can have those abnormal cells invading other areas. So you could have the cancer spreading, right, to the vagina, to other organs, and then ultimately, leading to poor quality of life, death. Right, without treatment. And that's why it's very important to screen for cervical cancer. We don't want to wait for a woman to start having symptoms, right, of cervical cancer, because then oftentimes when you start having symptoms, it's too late. So ideally, we want to screen asymptomatic women who have no symptoms at all, but routinely they come every 3 years, they get checked. We do a pap test, and that will be the first indication that something is wrong, right? So if we're just seeing, abnormal cells on a pap, it's very often that the case where we can do something about it before it gets to the stage of cervical cancer. Yeah.
Okay. So how is cervical cancer treated?
So there are a number of ways to treat cervical cancer. Sometimes it involves surgery. Other times it could also include radiation or chemotherapy. So
it's more or less the same thing we've been hearing from all of the healthcare professionals with the majority of these chronic diseases, that the best thing to do for prevention is to get checkup, to be proactive with your health, to take care of your diet and exercise.
Absolutely.
Thank you so much for all the information and answering these questions.
I should probably add also to that, like specifically speaking to Black women, that it's even so much more important for Black women to take this seriously, because we know that cervical cancer disproportionately affects affects Black women, right? And it's not because of genetics. It's not the genetic difference between Black and white. It's more due to socio-demographic factors, lack of access, and also racism in various forms, why Black women have poorer outcomes, right? So it's very important that our Black female community have this information, know how to get tested, how to get screened, and where they can get these resources.
Speaking on resources, where can some of the viewers find some extra support or resources for managing cervical cancer?
Sure. So I would say your primary care provider would be a good place to start. Great resource if you have a family physician or have access to primary care. It could be through a nurse practitioner as well. Just getting that kind of information, building relationship, making sure that you're on schedule for your screening test. Other places like, there's resources online, government resources. So Cancer Care Ontario has a lot of information as well on cervical screening that can be accessed.
Okay. No, thank you so much again for having us and speaking on these topics. We really appreciate it. And folks, that's another segment on our public awareness campaign on chronic disease and Black health, brought to you by Tebu Community Health Center. Please tune in for more.
My name is Ruqayya Warsame. I have been a settlement counselor at Somali Center for 22 years now. I am somewhat aware of what's happening within our community. I've known a number of women who have had both cancers. Some of them passed away from it. I think one of the reasons could be perhaps the lack of medical history. Many of us, our parents and grandparents passed away, but we don't know what they were passed away from. So, for example, if somebody were, many times I was asked family medical history, but I have nothing. It's blank. I don't know what my father was passed away from. I don't know what my mother passed away from. And those conditions might have affected us before, but we didn't know. We weren't aware of that. So nobody was talking about it. And a lot of people believe that something that just became an issue for us here, where there is the possibility that it was it always existed, but we didn't know. So there was no prior information. There was no ways of preventing it. We have to be proactive. We have to use what's available. I know a lot of women in their 50s and maybe even 60s who have been here for close to 30 years that don't go for cancer screening at all, whether it's breast, whether it's cervical, whether it is colon cancer, it doesn't matter. They receive almost every month, the papers are coming to their addresses, but they are not responding. So I think that would have been help because unless you know what's going on with your body, you're not going to find any solution. They might be feeling something, but they're not going to have it investigated. A lot of women are not. I know a lot of women, a lot of childbearing Somali women who never had a pap test, who never had a breast screening. Unless we use the tools that are available, these conditions are going to keep killing us.